Hello, I'm Dr. James Gray, a retired obstetrician gynecologist and secretary of the Upper Cumberland Medical Society, the Tennessee Medical Association's affiliate medical society for the 14 counties of Upper Cumberland. The United States is adding 64 new cases of COVID per 100,000 residents every day. Tennessee is adding 122 cases per 100,000 per day. The Upper Cumberland region is adding 165 cases per 100,000 per day. And we happen to be the highest rate of all the regions in Tennessee. Within the Upper Cumberland, Warren County has the highest rate of all the counties in Upper Cumberland at 266 cases per 100,000 per day. To start off with, you had very few cases in Warren County until the 4th of July weekend, at which time you had a surge up to about 30 cases per 100,000 per day as of August the 13th, at which time County Executive Jimmy Haley issued a mask mandate. You had a very nice decline in your rate down to 12 cases per 100,000 per day by the end of September. Then you entered the fall surge, and especially at 1st of November, it went up until, as predicted, Thanksgiving weekend, there was a shutdown in testing and reporting. And so there was a decline in testing and reporting, but cases were being spread throughout the region. And then when testing and reporting resumed, you found yourself in the middle of the post-Thanksgiving surge as predicted. This shows the intensive care capacity for the Upper Cumberland region and for McMinnville. You're lucky in McMinnville that you at least have one of the three hospitals that has any ICU beds at all, but you only have 8 ICU beds, and I'm sure they're all full now. Cookville Regional only had 48, and I'm sure they're all full now. And Cumberland County Medical Center was in Crossville was already full December the 4th, which is the last date with statistics available from the new federal database keeping up with hospitalizations due to COVID. I wanted to let some of our doctors speak, and one of the Dr. Brent Stanton. I'm afraid over Christmas there really is no room in the inn for people with severe COVID, and about all that our hospitals can do is to send people home on oxygen, steroids, and prayer. And that is a treatment Dr. Brent Stanton is getting now. He was unable to join our Zoom meeting because he was too sick, but he did make a PET podcast just a few days previously, and he asked me to play this excerpt for you about what he feels that people can do to get this under control.
Not been wearing a mask, get it out. Get a N95 mask if you can. Get a double cotton mask if you can. Get the best mask you can to fit your face. Protect your neighbors, protect your loved ones, protect your children, because you don't know in 10 years if your child gets COVID-19 today, whether they're going to have pulmonary fibrosis in 10 or 20 years or not, especially if they pick up smoking or vaping. We don't know the long-term outcomes to our kids. So love your children, love your neighbors, love your family, and love your nation. Let's double down and protect ourselves. Thank you very much for having me to talk today. I really appreciate it. And if this saves one life, it's worth my time. I'm fortunately sitting here on 3 liters of oxygen so I can have this conversation. This is real. So it's our nation at stake. This is the United States of America. There's nothing we can't do if we do it right and we do it together.
We only have 64 intensive care unit beds that are staffed within the whole Upper Cumberland region. We have 8 in McMinnville. We have 44 in Cookville. We have 12 in Crossville, and they're all full. And these ICUs need to be available for the conditions they were built for young people that may be in auto accidents, that have a flailed chest, and have a great chance for recovery. And we're getting to the point now where we're just not going to be able to give everybody a bed, and there's no place to refer them to because the major cities are all filling up too. So your physicians will have no choice when people get super sick, and they will. Christmas is going to be very rough, but they'll have to send them home on portable oxygen, steroids, and prayer. And that's about all that we can offer them. And the death rates will go up. We have monoclonal antibody available. This is can be given early on to prevent these serious complications. And we also have vaccines coming. But all of our healthcare providers are overwhelmed with people who are super sick. And we really need help in curtailing this. It doesn't have to be that way. It could have been prevented if only everyone would wear a mask to prevent the spread of this virus. And my message to you is to protect yourself and others until we get control of the virus. Wear a mask when you're with people who don't live in your household. Limit your holiday gatherings to people that live in your household, and keep your distance.
I'm Dr. Dawn Barlow. I am the president of the Upper Cumberland Medical Society. I'm an internal medicine physician in Livingston. And I want to take a moment to encourage everyone in the community to wear a mask and to social distance and to make sure you're using proper hygiene. We are seeing an uptick in the number of COVID cases in the Upper Cumberland. We're also seeing an uptick in the number of people who are sick enough to require hospitalizations. And we're seeing our friends, families, family members, neighbors continue to get very sick and die with this disease. We need everyone on board participating with masking, social distancing, and it's so important that every person in the community do their part so that we can get a hold of this infection and get it under control. We are also encouraging, when the vaccine is available, that everyone participate and get vaccinated when the time comes.
Thank you for having me, Dr. Gray. It's very simple. We've known about this for months and months and months now. This is really not, as I've said for many, many months now, it's not really rocket science. As you've already said, we have the vaccines on the way. Some are actually, I think Vanderbilt even got some injection today, and we've got them on the way there. But we know that it's going to be months and months and months before we really have the immunity from these vaccines. They're just not going to work instantly. We're so glad we're having them, and this is something we really need, but we've got to do something in the meantime. And as we've said many, many times, or as I've said many, many times, this is just not really rocket science. Face masks, just very simple face masks. Studies have shown that we can reduce the rate of infection by 80% if we just had universal masks, if people would just cover their face, their nose, and their mouth. The reason why is because this is an airborne virus, and that's the way it's mainly spread. Now, obviously there's other things that we need to do too, but I'm a big proponent of the mask being probably the most important thing to stop.
Earlier, you told me about an experience that you had with this virus firsthand. Would you mind just repeating that? How did you catch this virus?
Sure, I'd be glad to share it. I was in a closed environment with someone that was asymptomatic, and they did not wear a mask. I had a mask on, didn't have an N95 mask, but I had just a regular mask on. Did all the measures that I was supposed to, tried to stay my 6 feet apart, did the hand sanitizing, and after about 3 days later, I got a call from the public health department that the person that was totally asymptomatic, the gentleman was, and he tested positive. And that afternoon, I began to run a fever, and it went downhill from there. And I still have lung damage associated with that. That's probably most likely going to be permanent.
As Dr. Duke said, this is a respiratory virus and prevention is simple. It's not rocket science. It's simple. Wear a mask and just use basic hand washing. Distance yourself when possible. That's easy. So my office has not closed like most primary care offices. And we wear masks. We have a mask mandate in the office. Anyone in the building has a mask on. In our office, we've had 6 staff members test positive. We've been doing screening of our staff members, and we found 3 of them through screening. 3 of them developed symptoms prior to screening and were discovered that way. And we have an office of about 25 people. So we've been fortunate in that sense. I know some primary care offices where 90% of the staff has been infected, sometimes all at once, and that's forced closure, and sometimes over time, which just increases stress. Certainly healthcare personnel are not immune. Dr. Duke had an experience with it. We've had several members, several rural physicians in the Upper Cumberland and a little wider area succumb to this. Dr. Staten, with whom I work closely, and he had not a terrible initial course, but he is having a severe after effect of this virus, and couldn't join us tonight because he's so short of breath, even with oxygen on. He doesn't have the breath to talk at length, more than just a few words or a sentence or two. He's struggling. He's had all the treatment there is. I mean, the whatever's recommended that's out there has been available in our region, which is wonderful. And he has had that treatment, but he is still struggling, still on oxygen. And we don't know what the outcome is going to be, if he's going to have permanent lung damage, heart damage, or other. And so we're working with him very carefully and praying, of course. You mentioned that, Dr. Gray. It's pretty much just that. Treat as best we can and pray. We know that 80% of people roughly who contract this virus will be fine. They'll essentially shake it off, as some of my patients say. But 1 in 5, 20% of people don't. And of those 20%, about a quarter of them are going to get severely ill and be hospitalized. And that is where the problem lies. And we can't predict who.
The message that we're all saying is please, please, everybody wear a mask when you're out in public with people that don't live in your household. Set an example for everybody. Limit your holiday gatherings to people that live in your household. It's not time to ask grandma and grandpa to go visit this year or to go to their house. They need to stay in their own house if you want to have Christmas with them next year, and keep a distance between yourself and others. And we need to ask everybody to do this, please, because we need our healthcare providers. We need people like Dr. Staten. We need all of those ICU beds in McMinnville to be available for when there's auto accidents or other things that we have short needs for ICU beds. These COVID patients take up these ICU beds for a long time, and a lot of them just don't make it. So anyway, that's our message. Yeah, Ty, go ahead.
If I can just say one more thing, we've said this: prevention is simple, treatment is complex, but the real complexity here is attitudes. And so in America, when you look at a world map, America is doing the worst of all nations in the world, essentially. And if you look at one characteristic of America, if you ask anybody in this country, what is a characteristic of America, one defining characteristic, and I've done this before over the years, the answer is one word: it's freedom. It's freedom. We want our freedom. We want to be able to do what we want to do when we want to do it. Well, there was a notable scholar and speaker by the name of Os Guinness, who several years ago gave a presentation, and he said, the number one enemy of freedom, and he paused. He asked the question, does anybody know what the number one enemy of freedom is? And the answer is freedom. And this pandemic is proving it. We are currently our own worst enemy, because instead of protecting and loving one another, we are wanting our own freedom to do what we want to do when we want to do it. So I'll come back to the message that we've all stated: prevention is simple. Please wear a mask.
Thank you.
I think what it comes down to
as an American nation, we need to refocus on unity and protecting one another. And I'm sure everybody out there listening probably will understand this. You love God and you love your neighbor. Unfortunately, not only did I contract COVID-19, but I also contracted type B flu as well, and I have an underlying asthma. I contracted type B flu because we're short on flu vaccines in our area whenever I needed one. I had one left in my office, and a patient comes in with hypertension and diabetes. I chose to give the flu shot to the patient, not myself, because they needed the protection, because I didn't want them to end up having flu and COVID at the same time. As family medicine physicians and as doctors as a whole and as healthcare providers and frontline workers, our number one goal is to serve patients. We don't want to be heroes. We're a servant community. We don't do this for glory. We don't do this to be called heroes. We do this to serve. That's it. And we can serve our patients much better if they would assist us by protecting themselves, which then in turn protects us. All we want to do is take care of and love our patients. My pulmonary function test showed I was in my 30s before COVID hit. My pulmonary function tests today show I'm 74. I take very good care of myself as a physician, because if I don't take care of myself, I can't serve anyone. I just hope this helps. I mean, if this will save a life, it's worth it. We've had patients lose limbs. The things that we're not talking about in this, there's disabilities associated with this post-COVID. So if you don't have symptoms today, you don't know what your symptoms are going to be 10 years from now. We're going to have to get back to the point to where we can trust our doctors, where we can trust our scientists. We can't continue down a pathway of distrust. My patients who have died of COVID would not be dead today had they contracted COVID this year. There's been an additional 300,000 deaths in our country who, for some reason, seem to be a silent, dark hole in our chest that no one seems to be noticing, I guess. I mean, I hate to put it that way, but just because you're 65 years old and you have COPD doesn't mean you deserve to die. Just because you're 72 and you live in a nursing home and you have medical problems doesn't mean you deserve to die this year, just because we have a pandemic. And people who don't believe this is a pandemic, I'm not sure where they got their medical training from. I'm not sure where they got their master's degree in health policy from, but I think it's pretty simple to look up the word pandemic and see that this is a pandemic. I think what's happened in our nation is fear and misunderstanding. When all of this started, it was downplayed. Oh, it's fine, it's no worse than the flu. Yes, it is. On a bad year, we'll lose 60,000 people to the flu. On a bad year. This year, we've lost already 300,000 Americans. And I'm telling you, looking at data, if we don't move faster on this vaccine, people are going to go have Christmas, and the same thing is going to happen after Christmas. That's happened after Thanksgiving. People are going to go to New Year's parties, and the same surges are going to happen after New Year's that happen after Thanksgiving. And we're going to have more and more deaths, and we're going to have record deaths. 3,000 people died in a day so people could go have Thanksgiving dinner. So we need to redouble our focus on mask wearing. And when I say mask wearing, wear the appropriate masks,
Wear your masks correctly. Don't wear it under your nose. Don't wear it under your chin. Wear it up on your face. Cover your nose to your chin. Tighten around your face. Make sure you protect your family at least. If you're not worried about other individuals in your community, at least be selfish and take care of yourself. Because by retrospect, if you do that, then you're taking care of everyone else. There's a lot of symptoms of coronavirus: fever, chills, cough, shortness of breath. I've had excruciating pain. It feels like someone has about an 8-inch leather belt wrapped around my chest, and I'm in a torture chamber, and they're tightening it as tight as I can possibly tighten it. I can't lay in bed elevated. I have to lay prone as much as possible, or I have to lay flat on my back with a single light pillow. So I'm here to tell you, this is no joke. This is serious. This is killing people. It's wearing me out, fellas. We're about there. We got it. I can do it. We got it, man. People want to live a normal life. Okay, living a normal life right now is wearing a mask until we can get vaccinated. And if you're not willing to wear a mask, then stay home. But people not wearing masks in public, I can't even get to the level of disrespect for other human life. So there's a lot of armchair quarterbacks who complain about a lot of things, who have a lot of comments on a lot of topics that maybe we should be cautious about listening to. We hear a lot about herd immunity. The only safe way to get to herd immunity is through vaccination. If we achieve herd immunity through infective processes, infecting our nation, I want to lowball the number a little bit. Let's just say there's 300 million people in our country. There's more. And we have a 1.7% death rate. That equates to 5 million people. So God has given us a brain above all other animals. He's given us a mind, cerebral cortex, so we can function at a higher level, so we can protect our human species, so we can provide services to each other, so we can protect through vaccines, so we can protect through medicines. Let's use that God-given gift that we have and serve our fellow man. Let's protect one another. Love your neighbor as you do yourself. Love God. We can retrospectively look back again as armchair quarterbacks, and we can complain about how our government handled this. We can complain about our governors. We can complain about our president, our Congress, our local officials for not putting in face mask mandates. We can even complain about our healthcare workers. But it's not effective for us to retrospectively look back at this point. We have to move forward on this disease. If we don't, we're going to achieve numbers of deaths through not being vaccinated that are insurmountable for families. You can't get your grandmother back. You can't get your grandfather back. You can't get your father back. Trust me, I've lost all of mine. Thank God not to COVID. We need to refocus on a proactive plan rapidly as possible to mitigate the spread of this virus. We need to, as Americans, focus on mask wearing, social distancing. Do not go to Christmas dinner, please. We have Zoom. We have all kinds of opportunities to do it. If you're going to do it, you need to do it in a social distance manner. We have to take these efforts now while we're administering the vaccine. This vaccine likely is going to take us into the third or fourth quarter to get people vaccinated. And that's just if we move rapidly before we're going to reach to where we need to reach as a nation. There are other nations around the world, like Australia, for example. Their flu season was abated to near zero. They have hardly any infections whatsoever in their country. They're very proud of the fact, and I know a lot of doctors there, and I know a lot of people there. I talk to them all the time. They're very proud of the fact that they were willing to come together as a community. They're very happy that they do have a normal life now. They go out, they still wear their masks just in case. New Zealand is another example. Their infection rate is excruciatingly low. If you look around the world, the numbers are excruciatingly low. In our local area, we utilize the Italian data and the New York data to make decisions more rapidly. As physicians, we kept our numbers low for a while until people decided to drop their guard. When people decided to drop their guard, infections began to rise, which is exactly what we projected. Our data projected approximately 2,000 deaths by August 1st. Our data was spot on because we knew the behavior of our communities. Talk to your physician if you have COVID-19 about your treatment plan, if you need to talk to them every single day. Our number one goal is just service. Our number one goal is to love our patients. That's all we do. That's all we want to do. All you have to do is go back to the basics to mitigate spread. Wash your hands, social distance, love your neighbor, wear a mask appropriately, and take care of your health. As we know, suicide rates, drug use, alcohol use, domestic violence, child abuse, all of these things are on the rise during this very stressful time. But most importantly, we now have a weapon in our war. Now that we have a weapon in our war, that's not, quote, just a mask. Please wear your mask now. This is the perfect time. If you've not been wearing a mask, get it out. Get a N95 mask if you can. Get a double cotton mask if you can. Get the best mask you can to fit your face. Protect your neighbors, protect your loved ones, protect your children. We don't know the long-term outcomes to our kids. So love your children, love your neighbors, love your family, and love your nation. Thank you very much for having me to talk today.